Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective. Welcome to Behavioral Health Today. I'm your host, Peter Fenger, and today I'm joined by Tamar Blue. Tamar is the founder and CEO of MentalHappy, a trailblazing health technology platform that brings peer-led emotional support to people of all backgrounds. After beginning her career in staffing and co-founding a successful HR tech company, Tamar transitioned into health innovation to tackle the growing need for accessible, community-based mental health care. Since founding MentalHappy in 2016, she's led the company's mission to empower providers and individuals alike through expert-led support groups combining technology with human connection. Now based in San Francisco, Tamar continues to champion scalable solutions that reduce barriers and promote health. Well, we're excited to have Tamar on the show today to explore how her early passion for peer support evolved into founding MentalHappy, a platform tackling provider burnout and access gaps by enabling secure, expert-led support groups, and how scalable, community-based mental health care is being reimagined through technology, innovation, and inclusive design. Tamar, welcome to our show. So happy to have you here today.
Thank you so much, Peter, and thank you everyone for listening.
Yeah, well, we're very excited to have you here. I've had a chance to dive into MentalHappy myself and really excited to share this with our listeners today. As we get started, I'd like to start at the moment where your passion for community-based mental health and emotional support began. And I want to ask, what was sort of the spark that evolved into founding MentalHappy?
Originally, my passion for support groups began as young as high school. It's my
Mm,
very first group that I started. It was called Safety Ambassadors. It was just really in response to a lot of the trauma that was happening around shootings in school and just some of those traumas associated with that. And fellow students feeling isolated or maybe bullied, and finding some type of mitigation for fellow classmates that were maybe felt like they didn't have any friends, didn't feel safe walking from, one class to another, or felt alone. So pairing them with upperclassmen and lowerclassmen can really be paired with them and have a friend, right, in school.
mhm,
So it started there. And as I grew older, I really loved technology and how technology can really fill in gaps in a lot of places in our lives. For me, particular, it was looking and examining social aspects of healthcare and impact. And with MentalHappy's story, we began with a really small group on a social media site that grew
mhm,
into 80, 90,000 followers. And we were trying to create subgroups and communities on the social media site. It became very unmanageable in
mhm,
terms of bots and advertisements, and it's difficult to accept payment.
mhm.
That's like all over the place, right? So
Right.
I really set out to build something that really helped us in the beginning in terms of how are we running groups. Okay, we don't want advertisements. We don't want to sell people's data. We want to make sure everyone that comes on to the platform and within the community is a human. And we wanted it to make it streamlined and easier for us as group facilitators to run groups. And
Mm.
lo and behold, other providers, advocates, survivors, licensed therapists, even doctors were also interested in running a streamlined group process because they had a lot of the similar logistical challenges.
Yeah. Yeah. I mean, that's incredible just to think, just those early seeds from high school really budding into this. The experience of, running those early support groups and really giving you motivation to build a better platform, just focusing on those early support groups and sort of the experience of working in social media. What were some of the limitations of that environment, and how did those inspire some of the features that you have on your platform today?
Well, the first part is that it's
Yeah.
social, right?
Mhm, right.
That's the first component of it. And what we were doing was not social, but more so like community and healthcare driven. So that was the first hurdle. It wasn't, just saying, "Oh, look at me and what I'm saying and what I'm showing." These were very vulnerable and sensitive conversations that people wanted to keep safe, and they didn't want, if something's on a social site, it could come up. You could see people's comments on a friend's feed, right? So you didn't want that type of information getting out. So that was like the first hurdle. The first hurdle was like privacy. Like, how can we really create this space that was private? We also had other experts and group facilitators and speakers kind of coming into these subgroups that we created, and we had to pay them. And we had to collect payment on their behalf for people who wanted to participate in their services. And that was very messy. So the payment component was very hard.
Mm.
And then just getting people into the groups, like there wasn't really a very clean onboarding. It was like they came into the mass page and then they could find these groups. So just onboarding was a mess as well.
Right.
Communication, checking DM messages. A lot of those DM messages are just spam. And sometimes things where people would say things about like self-harm. And it's just like, how do we handle that? Right.
Right.
And it's in a DM message. So logistically, it was just, we were on something that just, was good for a lot of things, but just wasn't good for the impact in care and support that we were trying to make.
Yeah, yeah, and I can see how some of those limitations on those other platforms really gave you a checklist of items that you guys are accomplishing. I'll say to the listeners that I've had a chance to create a profile on Mental Happy and join a couple of the support groups, and I can see those things that you're talking about, making a safe gateway for payment for the practitioners. That's important, but also just the safety and privacy for the users itself. And also just a engagement. Like it felt very welcoming to come onto the website as well. So there is that level of personality that came through. You're talking a lot about community health, community care. That bit of human interaction is being shown in the in sort of the layout of your website. I felt it.
Yeah, for
Yeah.
sure. Thank you so much.
Yeah, and again, I want to park on that. The community care aspect. You've said that community care is healthcare. Can you sort of expand on what that means in practice? I know you're talking a little bit about underserved populations, you're talking about rural populations, but what does it look like in practice?
Yeah, absolutely. So I was actually talking to a practitioner just this morning, and he said it best. He is a licensed therapist, and he was like, with all of the book knowledge and clinical knowledge that I have,
Mm.
because he's also run support groups pretty much all of his like 20, 30-year career. And he said that there's just nothing compares to really getting your clients together and being able to be in community with other people who are able to deeply empathize and understand what their experience is.
Right.
Also, community care can also look like something as simple as practical advice. Perhaps you are a caregiver, and this piece comes from a real story, but perhaps you are a caregiver and you are caring for your aging parent, and you have to come up with ideas on how to rearrange your parents' house. Let's say you didn't even know that now that your parents are aging, right? It's important to like rearrange their house, rearrange their bathroom so that it prevents like falling and accidents. These are the type of nuanced things that, yeah, even if you go to a doctor and that doctor's a specialist for geriatric care, maybe they didn't remember to tell you, maybe they didn't tell you, but just these day-to-day living type things in real time is why that community and localization of that, even if it's virtual, localization in terms of like conversations, right, is just
Yeah.
really important.
Yeah. 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 I mean, again, you're creating these groups with people with lived experience and just a familiarity of what that experience is looking like. Yeah. Yeah.
Right.
I mean, it's a special superpower that you guys have at Mental Happy.
Yeah, and a lot of studies have shown that that type of community care can really amount to as much, I'm not saying completely
Mhm.
30, but as much as 30% of improved health, that person's improved health outcomes.
Right. Yeah. Yeah. And I've seen some of the stats that you guys have on your website. Just to name a couple of them, you guys are talking about how we're improving and sort of streamlining the flow for not just better treatment, better care, but also for the providers, the practitioners themselves. Here's some stats you get on the website. You found about 30% less time on logistics and onboarding, scheduling, and rescheduling. So again, this is some of the backbone that you guys are trying to hit based off of your experience from social media, really trying to create a better onboarding experience. If the other stat you have is
Absolutely.
50% more time focused on things you enjoy while helping people in need. This is talking about how you guys have streamlined the platform to help out practitioners and really trying to get them to deliver the good care that they've got faster. And really speaking to some of the challenges, I want to ask you, what are some of the challenges that you guys are seeing in practitioners, maybe
Mhm.
burnout, administrative load, that you feel
Yeah.
like Mental Happy is actively helping to solve?
Yeah. So there's a couple of things happening in the mental health market industry right now. There is a pretty heavy decline in new providers joining the mental health industry. And we've seen that really blow up around once COVID hit.
Yeah,
There just wasn't enough
right.
therapists to go around for the amount of people that were seeking services. And then also, what's oftentimes unspoken with, and not just therapists, but most frontliners, I definitely consider therapists frontliners, but with most front is that they experience a lot of burnout. And then that burnout in turn creates early retirement, leaving the field for something else.
Right.
And what a platform like Mental Happy does in terms of cutting down their onboarding time, allow just because someone has a good clinical skills, that doesn't necessarily equate to sustainable businesses, right? Like it's
Exactly.
sometimes difficult for them to scale their healthcare business. So
Mhm.
what a platform like us does in terms of the no overhead, right? Because we're software based, we're a health tech company. So there's no logistics of like adding an office or anything like that. And then removing the logistics of like maybe you wanted to start a support group, but it's just now you have to create a web page maybe or add
Mhm.
something to your web page, which means you'd have to hire a technical person to add to, or maybe you have a technical person that manages your website and now you have to
Mhm.
pay them more money to add this component of your business. And then perhaps there is some type of, okay, maybe people have to email you, they have to call you to get access to the group, and you have to do some type of vetting or onboarding to get them into the group. And then you share a Zoom link, and now, okay, now you have to kind of go back to an EHR and collect payment through the EHR. And it's just this, just like a lot of, and then the more the provider thinks about it, they're like, actually, I'm not gonna run a support group, even though it could create supplemental income, even though I could see more patients. It's just like, it's just a lot of work with all the things that you already have going on.
Mhm.
So in that regard, we solve a lot of problems. And it's also, yes, the things that they enjoy, but also just being able to do the the clinical work that they want to do, right? Or the
Mhm.
clinical work that's needed. Not everyone needs talk therapy for 50 minutes once a week, twice a week. Sometimes people could use the education and the community, and that's enough to help them navigate their life experiences. And even therapists
Mhm.
know this. That's why they also, a lot of them offer support groups as supplemental help. So on all of those fronts, on both sides, for the participants and the providers and group facilitators themselves, we really kind of bridge that gap in that supplemental care need.
Yeah, yeah, you're doing a really good job of explaining how you're solving a complicated problem. There are a lot of systems that go into running a safe practice. And there are also a lot of skills involved with running a practice, right? Having to
Right.
collect payment, having to market yourselves. You're really eliminating a lot of these barriers and really empowering, you're talking about solo practitioners that want to run a support group or a small practice looking to really expand their reach. You're doing a
Yeah.
really good job of explaining how Mental Happy is solving a complex problem with a lot of different systems and a very easy solution.
Yeah, and what we find with some of the customers that come to our platform is that before they came, they were using maybe a lot of complicated things. Maybe they were on Meetup and
Mhm.
Eventbrite and Facebook, and they had like a WhatsApp group, and they had Zoom, and they collected payment through an each EHR, or maybe they used something like Jan. and they ran their solo practice, their small practice, mostly with the Jan tools, but then they had some type of support groups and coaching that they were kind of running through Jan as well. And just for like compliance reason, like if it's coaching, it's not therapy, right? Just like
Right.
legality wise, it's just you're
Mhm.
not that person's provider. You're not responsible for them as like a coach. So it does make sense to separate entities of your business that really open you up to risk, right?
Mhm.
So that's also one of the benefits of keeping them
Yeah.
separate.
Yeah, definitely. So you've got a really great platform. Let's walk through it. So, can you walk our listeners through how a provider goes and sets up a group on your platform? Talk a little bit about onboarding, maybe some of the privacy settings that you've got, what the
Yeah.
video sessions look like. Talk to us about it. What does that look like?
Sure. So you would go to mentalhappy.com.
Mhm.
You'd click get started. It's a very short form. Should take you maybe like 5, 6 minutes to complete. You would set up in terms of your group, you'd pick a group topic. You write out a small description on what your group services are. Many providers already have an idea of this. If you don't, it takes you a couple more minutes to just maybe think through it.
Mhm.
We strongly encourage if you have any group guidelines, put that on there as well. Maybe it's an SA group, a DV group, LGBTQ, whatever the trigger may be for some people or sensitivity, put that on there as well so that people are aware. And then if there's a group schedule, you can put that on there. If there's not a group schedule just yet, you can say see group schedule in app. And then you pay for your group and then you hit submit. Our moderators review every single group that comes on the platform, whether you are a licensed provider, whether you're a coach, or let's just say you're even a survivor of something, an advocate. We review all the groups just to ensure that if you say you're licensed, we verify that. If you say you have expertise, we verify that. That just takes less than a day, it just takes a couple hours for just someone to see it. And then your group is live on the platform. You can schedule a call with someone on our team to walk you through what the platform looks like, how the platform would work for you, and then how you would explain it and how it would work for your clients and patients to ensure they understand. We also even give you a helpful one sheet that explains to your clients and patients how to onboard into the app, whether they're using web or if they're downloading iOS and Android for the app, just to make sure that it's a smooth transition and care, right? We don't want to cause anybody any additional friction. I mean, we've even seen people using the platform for like cancer support groups, right? We don't want to cause anybody any additional trauma or friction. So,
Right.
making sure it's a smooth transition for all your clients is our highest priority. You would receive a unique URL link for your group.
Right.
So, that also makes onboarding very easy. You can share the link with clients, patients, so that they can seamlessly enter the group. You set the tone in terms of the cost for your group, whether it's one time payment, monthly payment, whether your organization, maybe you're a nonprofit and you're just accepting donations, or even if you're a solo practice and this is something that you offer for free in conjunction to your one on one practice, you can not charge for it, whatever you'd like. And then again, those group participants would have access to your group via mobile apps. You can also set the settings. If you're looking to scale and grow your practice, Mental Happy is fantastic because it allows people who are coming into the platform searching for groups to find that your group is open and available. If your group is public, people can just join, see the guidelines, pay the whatever your service fee is, and join. If your group is public but has some joining restrictions, people have to request access. They can see your group, but they have to request access, and then you give them permission to join. If your group is just for your practice, which we have a lot of people on the platform where it's just completely hidden, it's just for their solo practice, then people would only join based on that URL link that you share. And you know that all those members in that group, they came from like your client base, your member base. So a couple of modalities for you to really manage this client facing modality for your practice.
Mhm. Yeah, yeah, and again, you're kind of walking through that. In the time that I've spent on your platform, I experienced that. I encountered a group where I was able to join with no restrictions. I was able to see other groups with payment options. And then I was able to look at a group that required an additional step in order to get admittance to it. So what you're
Mhm.
talking about, different levels of privacy to your support group, I was able to see that, and it made it very easy. The other thing that was also very nice is that you also include space for imagery that can also help out for branding purposes. So if
Hmm.
you're interested in that sort of marketing, making sure that the existing clients that you've got in your platform, there is a level of branding involved to where
Absolutely.
people can feel like they're landing on the right space as well. I think that that's important
Absolutely.
too.
Yeah, you can add your logo,
Hmm.
any type of like banner assets. And we did take a couple of small little pieces of social media that, people enjoy. People like
Hmm.
videos. So you're able to upload a video
Hmm.
to on your group page to just maybe introduce yourself, explain who you are, your background, why people should join your group, or just even giving them just kind of like the overall house rules of the group. You can use that video however it serves you. And then also the other component that I wanted to mention about the group on the back end of that is that we also control the security and privacy on the platform. So we're able to make sure that there's no advertisements, there's no one like spamming your groups or anything. Like we
Yes.
immediately flag it, catch it, remove it. And then screenshots are also forbidden on the
Hmm.
platform. So if anyone from their device, takes a screenshot, the app will send them an alert like, hey, these aren't allowed. And if it happens a couple of times, then we alert you and you can decide if you want to keep the person or not. But we let people know that screenshots aren't allowed because we don't want people sharing the vulnerable conversations outward. So there's a couple of things that we embed in there to make sure that it's truly a safe platform for both the provider and the group participants, and providers themselves are able to also include moderators and other admins. We have
Sure.
people on our platform that when we were starting out just had like one single group, and literally I talked to a nonprofit the other day. They're a behavioral care center, but they're nonprofit focused, and they've grown to like 22 groups.
Yeah.
So and
Wow.
varying ranges of, some they charge for, some are free. So we've definitely seen people scale up their
Mhm.
organization on the platform, and that's really exciting to see.
We'll be right back after a word from our sponsor.
Are you preparing for a licensure exam in psychology, social work, marriage and family therapy, counseling, or behavioral analysis? AATBS is here to help. We have been supporting behavioral and mental health students to prepare for their licensure exams for more than 45 years, working with over 1 million students to succeed on test day and move on to the next step in their career. With products ranging from comprehensive courses to quiz banks and delivered live online, self-study online, and in print, AATBS has test prep solutions that meet every student's needs and learning styles. Visit us today at aatbs.com. That's aatbs.com and use promo code BHT15 to save 15% off your next purchase.
That is exciting. And again, I appreciate you sort of laying out some of those details around safety. Again, you're really approaching this from a HIPAA compliant social experience. You're also trying to create engagement, but also there's a degree of privacy involved. I want to ask, because I know that on your platform, when folks are sort of arrive into a group, there's a space where you can sort of message. How are those messages being regulated? Like if I'm sharing something very specific and vulnerable, like I'm contemplating suicide and I'm in a suicide prevention group, how are those messages vetted?
Right. So one of the first things that we do with anyone that comes on the platform, whether they're just your clients or they're looking for just an overall group on the platform,
Yeah.
we ask those type of sensitive questions up front,
Hmm.
just for precautionary reasonings, and also so that we can get people the immediate help they need. So if someone's coming onto the platform, we do ask, have you recently had any thoughts of self-harm? Have you attempted self-harm recently? Because we want to have them sent to partners that handle high levels of crisis. because that's not what we do.
Right.
And that's oftentimes not the purpose of a group, a support group, even if the
Right.
support group is a suicide prevention, right? If someone's at that peak level, you want to get them help immediately. And then the second part of that is we definitely monitor the platform in terms of like those conversations. So we don't monitor the platforms in terms of like we're reading people's conversations all the time, but
Sure.
we are alerted once trigger words pop into the system that then it causes to like, okay, look into that chat message to see what it said. We also don't allow DMs. And
Mhm.
this one is something that I really want to take the time to explain because a lot of group facilitators and a lot of people on the platform, you may be licensed, and across state lines, the rules are different. And you can really only be in group therapy if all your patients are where you're licensed. But you can facilitate support groups across state lines and be a leader, an expert, or facilitator of that group, not their provider or practitioner across state lines. But if you're involving in like DM, someone could say something sensitive that would immediately assume that you are their provider, especially things of like self-harm and stuff like that. We do have one small tool on the platform that allows people to ask anonymous questions. If it's something super vulnerable, that does go to the group leader. They can decline the anonymous question, they can edit it before they post it. And that way that kind of gives the group participant the ability to say something, but without
Wow.
it being shown as to who said it, if they want to keep
Okay.
that part. So that's like in lieu of DMs, we allow that small feature.
That's very well thought out. Again, I can see how some of the challenges that you guys had on social media, the social media platform, have really piggybacked into this very safe environment that is both empowering to the practitioner, but also very welcoming to the users as well.
Right.
Yeah.
Exactly.
So let's talk about the support groups themselves. And I want to ask you, as you sort of seen the platform evolve, what are some of the groups that are resonating with users, and what sort of trends are you seeing around certain topics, maybe parenting or trauma? What does that look like?
Yeah. Yeah. Caregiver support is a big one.
Yeah.
And
Hmm.
I'm really happy to see that it's a growing group base, mainly because there are so many informal support caregivers in America.
Right.
The other growing trend, which I have to say, I really wish we had more of these type of groups on the platform, but I definitely see it expanding, is support for parents raising teenagers.
Mm.
And preteens is something that people request a lot on the platform, and we are seeing more group providers offer those type of like family therapy
Hmm.
services, like family therapy. The family therapists are offering those type of group support, and LGBTQ groups are quite
Hmm.
expanding on our platform.
Yeah.
Groups for BIPOC support,
Mhm.
people of color, is growing on the platform. My favorite that has really expanded is men's groups.
Mm.
Just
So good.
really, I mean, yeah, we don't see that enough in
Yeah.
society. Like
No,
society just kind of sometimes skips over the needs of men, right? Like they have to be
absolutely.
strong, they have to be this and providers and that. So seeing more support in that regard, and just things that, unless it's happened to you, you really don't think about. Like I came across an adult adoptee group
Oh,
on the platform. So people who had
sure.
been in foster or adopted as a
Hmm.
child and really unraveling that experience as adults, like moms groups, right? Like whether postpartum, like just all things related to that. So I tell people that anything that people go through under
Yeah.
the sun here on earth, there's typically some type of support and empathy for it. Long-term disability care
Wow.
is also growing on the platform as well.
Yeah. Man, that is so cool. You're talking about so many groups that when you're in it feels so isolating. And you're talking about a platform that is giving those folks a chance to have a relatable experience and for us to guide. Social media can be very harmful, right? But what we're seeing in this platform is really the best that we can offer. It's offering a personal experience and really offering a chance for folks to truly connect with others in that experience. So good. I mean, even you mentioned men's mental health. My own experience is really trying to comb through a number of other groups, and other platforms, Meetup, a couple others, and just being very unsuccessful. So I'm eager to really jump back into the platform and see what might be available and hoping that it might be a better fit to me
Yeah,
myself.
absolutely. Yeah, for sure. No, for sure. The other challenge that we didn't touch on for group participants is how difficult notoriously it is to find
Yes.
a support group.
Hmm.
Maybe you're lucky enough to where your therapist offers some and
Yeah.
you were seeing someone one-on-one and they offered you these supplemental services or they referred you to another provider friend that they have that has these services and people go to church less, far less
Yeah.
than our generations before us, right? So oftentimes churches were a place where people would find these type of smaller groups. And, if you don't go to church, you're likely not going to
Right.
find one. If you're not in college, because oftentimes on college campuses, there might be some type of, supplemental group. So they're in
Hmm.
places that it's kind of in the decline of where, and we live further away from our family and friends and where we grew up. So
Right.
that makes it difficult to kind of tap back into community. So there's
It
a
does.
lot of reasons why finding support is very difficult, and our platform is really making it a lot easier. Is in terms of like a Google search, if you
Right.
put in support groups, Mental Happy should come up.
Yeah, that's so awesome. That's so awesome. One of the things that I was so impressed about the platform is its ease of use, and my mind just started racing on its applications. And I want to ask you, as you sort of see Mental Happy expand and sort of grow, do you see other areas maybe adjacent to mental health that you guys can use
Definitely.
your platform and sort of adapting? I know you and I talked a little bit about its use in healthcare, but
Mhm.
play with this. Let's brainstorm.
Mhm.
What else do you see it going into?
Oh, yeah, definitely. Earlier, I mentioned the desperate need of parents to find more support in
Yes.
raising teenagers nowadays, preteens nowadays, just because they have so many nuance of issues that,
Right.
I don't know. I feel like my childhood was much more simpler times than what parents are navigating today.
Yes, it's
But
very narrow.
so I would really love to see support groups implemented in the K through 12 school
Hmm.
systems, mainly because there is such a severe shortage. Some schools don't even have therapists as an option or counselors
Yeah.
as an option. And guidance counselors usually have to kind of run interference in being a therapist.
Right.
And it's not the same, maybe clinical, information that they could offer, but they're definitely doing their best. So I would say support groups for both the students in that regard and even groups for parents through the K through 12
Okay.
system, especially as many schools are starting to transition to being virtual and kind of
Hmm.
losing connection to community a little bit. Definitely hit
Yeah.
the nail on the head with hospitals as well.
Mhm. Yeah, I mean, again, I want to piggyback on this idea of just a resource for parents as well as students. Like, how good of a connection can you have with your child if you are aware of things that are happening within the classroom? Or even just how supportive can a group be as a parent if you know that every Thursday or once a month, there's a place where you can go and collaborate with other parents that are in the same grade as your child, knowing that they're spending the majority of their week together, and just a safe space where you can both collaborate and sort of engage with your child in that way. I can imagine that
Yeah.
can be so empowering for parents.
Yeah, and if you're a parent that has a child with maybe a particular disability, right? It may
Yes.
be tough to find. So, I mean, I grew up in a pretty small town in Florida, popular location, but
Yeah.
pretty small place. And it may be difficult to find a few parents dealing with the same thing within that school or even the neighboring school. But
Mhm.
if there was something virtually that could connect parents all across the United States, despite what school that they're in, then the
Right.
likelihood of finding other parents that have a particular special needs student in a particular population is a lot easier. Sharing
Mhm.
information becomes a lot easier, sharing resources, across state lines, county lines becomes a lot
Right.
easier. So
Right.
yeah, that's one of my dreams is to see it applied,
Yeah.
in at least over 50% of schools in America.
Right. I mean, and honestly, if we look at some of the activities that young people and children are engaging with, they're already engaging on sort of like that national, international engagement just through video games and social chat there. So as
Hmm.
a parent, you can step up to that level and have a relatable experience.
Right.
Yeah.
Absolutely. Yeah, for sure.
Cool. Well, hey, I know you guys are collecting data and analytics, and I
Mhm.
want to ask how you might be using some of that information and making it applicable for practitioners and clinicians. What sort of insights does your platform provide to help providers track and impact and improve outcomes?
Well, right now, one of the things that we're looking for specifically is an academic partner in
Okay.
this space, mainly because we do see, other than like NIH type journals and things that are published, there really isn't anything in real time
Hmm.
that allows practitioners to, or even group facilitators to see, well, what was the outcome of the group? How
Hmm.
have these individuals gone on to
Right.
improve their lives, improve their families, improve their communities? How
Mm.
are they applying the tools that I taught them? Maybe what tools that have I taught are useful, not useful. There really isn't any type of like feedback response in that support group loop. We just know overarching it's helpful, but it would be interesting to get very granular on, how, if we're able to track people's moods day to day in a support group versus after or
Mhm.
before. So we're definitely open to an academic partner that we can work with and really using some of that early beta information that we've received
Mhm.
and putting it in some type of peer journal that we can share with the industry.
Yeah, that would be so helpful and really show the impact what you're doing with Mental Happy.
Absolutely.
Um, I know on your website you highlight a number of case studies that really show Mental Happy's role in expanding access and improving client outcomes. But I want to ask you, share with our listeners, what are some of your favorites?
Yeah, I think there's some things that felt in terms of support groups pretty obvious to me. That
Mhm.
we've done a case study on a caregiver support. We've done a case study on long-term disability care and how support groups can really not minimize the emotional impact, but at least prevent like the loneliness and isolation in
Right.
that journey. But one of the case studies that's my favorite is the one on veteran life transitions.
Hmm.
So when people kind of go from like one phase of their life
Yeah.
to another phase, I mean, you could think of it as like when people kind of cross that 50-yard line of aging in their
Right.
human journey, right?
Yes.
I had always thought about support groups in terms of like something happened to you and you join the support group, but we oftentimes forget that support groups can fill the gap in transitions, like just things that are
Yes.
natural. You were in the military for a long time. It's time for
Mhm.
you to retire, but just because it's a natural transition doesn't mean that you're equipped with all the things to handle it naturally,
Mhm.
right? So, just some of the
Mhm.
success stories that have come from people not needing to rely on like substance abuse, people being able to work through their traumas, anything that they picked up in their time, especially if they're a war veteran, right? And they saw war times. So, I'd never thought of it that way. I just always thought of it as, and even with me being in the industry, I learn new stuff all the time, and how it can really fill that gap for people. So that's probably my
Yeah.
my favorite like success story.
Yeah, no, absolutely. And really just to highlight your platform once more, you're talking about, these support groups that can ease in transitions. In my experience in creating my profile, that was so easy to find. There were already tags built out, and I simply just clicked on the ones that I wanted to see, and I could find a support group that fit those needs. It was very easy for me to find it. So again, just highlighting just the ease of use there.
Yeah, absolutely.
No,
Yeah.
I know you have done an excellent job of really highlighting a number of great features, but I want to talk about some innovations. And I ask you, what are some of the ones that you're most excited about? Maybe expanding accessibility or adding new tools for providers. What gets you excited there?
Definitely the onboarding. So two
Yeah.
things. One is not so much, one is innovation and one is accessibility. The first part is adding more tools for the providers in terms of like onboarding. That's like the biggest thing. Like, how can they get people on there easier, faster, customizable intake forms that they can have on the platform? And then also note taking, being able to just kind of share some notes about individuals in the group. And then the second part that I'm excited about is expanding access. We're doing some really tiny betas testing out Mental Happy in different countries because of the inbound that we've received. Like, people kind of come across the platform on the internet and they're like, oh, if I'm in this country, if I'm in South Africa, can I add a group on your platform? I'm in Australia, can I add a group on your platform? So just really tracking where most of that traffic is coming from and being able to expand. We'll probably start off with predominantly English speaking countries outside the United States, but something that we're working on within the next year.
Yeah, that is very exciting. I'm really excited to see where Mental Happy goes, especially when you're talking about other countries and really engaging with other communities in that way. For professionals listening who are curious about using Mental Happy or creating a group, what's some of the first steps and what do you want them to know about what's possible?
The first step would be to go to mentalhappy.com. You can click the Get Started button if you're ready to start your group. Maybe you have a slightly larger support group system and you're a little nervous on how you're going to transition so many groups over. You can click the schedule a call, and one of the members of our team can kind of talk you through moving, larger groups or multiple groups over onto our platform, or if you just have any additional questions, we'd be happy to help. And what I'm most excited about for Mental Happy is just how well it's received from the professional community. It's really great to hear people who have like, wonderful PhDs and fancy licenses and education and just have been really doing this work for a long time say things like, obviously I'm not the technical person, right? It's not what I
Right.
do. So it's nice that, someone is doing this work. So again, we started from a place of we were just group facilitators. There are therapists on our team now, but there weren't any therapists at the time. So to just be really well received in the industry and be doing something helpful in
Yeah.
support of that is really nice.
Yeah. Well, again, you started off as community care is healing. And I know when
Mhm.
folks come together and they really have a spot in order to engage relationally with each other, true healing can exist. Knowing how difficult it is for practitioners, maybe not having the technical know how, but making it so easy for them to engage and taking these complex systems and really putting it into a very simple, easy to use platform again, can deliver the care that they so desperately want to give to other people, and making it very easy for them to engage with it. So, congratulations on your platform. But before we go, where can folks learn more about Mental Happy and how can they get started on your platform?
They can go to mentalhappy.com and click on the Get Started button. Or if you'd like to schedule a call with one of the members of our team to ask a few more questions, we'd be happy to chat with you.
Awesome. Well, Tamar, thank you very much for your time today. I've really enjoyed exploring your platform. I'm very excited for others to engage with it.
Yeah, thank you so much, Peter. And just thank you to all the listeners and just for the work that you guys do. I know it's not easy. And just want to say thank you for all that you do.
No, thank you there. And I want to thank you, our listeners, for taking the time to join us. You can follow us on our social media on Instagram, TikTok, LinkedIn, and YouTube at Behavioral Health Today. And if you like our show, give us 5 stars and leave us a review. That helps us get discovered and share the valuable insights in each episode. As always, the resources for this episode and an archive for all of our episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today. We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.